Hello, this is CJ's podcast, and I'm Api Chewcharat from the Mayo Clinic. On behalf of my colleagues, I'm pleased to give you the summary of our study, Trajectories of Serum Sodium in Hospital in 1 Year, Survival of Hospitalized Patients. Dysnatremia is one of the most common electrolyte abnormalities among hospitalized patients. Dysnatremia during hospital admission has been shown to be associated with higher all-cause mortality. However, serum sodium is changing throughout the course of hospitalization. So, looking at serum sodium trends in addition to a point-specific serum sodium might be better associated with mortality. Therefore, we conducted a retrospective cohort study among adult patients who had been admitted between 2011 and 2013 to investigate the association between in-hospital serum sodium trajectories and in-hospital and 1-year mortality rates. We created serum sodium trajectories by using group-based trajectory modeling to group longitudinal measurements considering the patterns of change across multiple time points and identifies distinctive trajectories. As a result, serum sodium trajectories were categorized into 5 main trajectories. In our cohort of 43,539 patients, 47% had stable normonatremia, 15% had uncorrected hyponatremia, 31% had borderline high serum sodium, 3% had corrected hyponatremia, and 5% had fluctuating serum sodium trajectory. Our main finding was that there were a higher in-hospital and 1-year mortality among uncorrected hyponatremia, corrected hyponatremia, borderline high serum sodium, and fluctuating serum sodium trajectory compared to normonatremia trajectory. Interestingly, of these, fluctuating serum sodium trajectory was associated with the highest in-hospital and 1-year mortality risk. We postulate that the fluctuating serum sodium may create osmolar stress that may perturb cell function, resulting in damages of DNA, cell cycle arrest, and apoptosis. Alternatively, fluctuating serum sodium may reflect impairment in osmoregulation to maintain the balance in serum sodium, which might be a more critically ill population that required fluid management or administration of hypertonic or hypertonic solutions, which could lead to abrupt and profound changes in serum sodium. In conclusion, more than half of hospitalized patients had abnormal serum sodium trajectory during hospitalization. Our study demonstrated that not only the absolute serum sodium levels, but also their in-hospital trajectories of serum sodium levels were significantly associated with in-hospital and 1-year mortality rates. The risk associated with death was highest when serum sodium considerably fluctuated during hospitalization. Thank you for your time and your interest in our study.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.